Right, this is sixth grade health, 124 to 127. Technically, there's a little blurb on 123 as well. Just a couple things for review from the previous chapter. Remember, we talked about the word auditory, meaning ears, the word olfactory with the nose, of course, taste buds, that's easy, and then optical with your eyes. And then we moved on to drug use and abuse. A written prescription for medicine from a doctor would be a what? Prescription, yes. And you've got the ones that kill bacteria, that would be antibiotics, and the ones that just stop the growth of bacteria, what would that be? Sulfa drugs. All right, the first antibiotic to ever be discovered was penicillin. All right, so if a drug is basically any substance other than food and water, which is taken into your body, causes basically your mind, your body, or behavior to change in some way. And intentionally using drugs for non-medical purposes, that would be abuse, drug abuse. All right, so then we talked about anesthetics. We had general anesthesia and local anesthesia. General anesthesia knocks you out, and it's causes anesthetics in general cause numbness. So general anesthesia would cause whole body numbness and put you to sleep. Basically, is what they would call unconsciousness. And then local anesthesia deadens just the senses around that area only. And then you have analgesics. Those relieve pain without deadening the sense of touch. And you've got narcotic analgesics, or not narcotics, and non-narcotic analgesics. Non-narcotics would be things that you would take for over the counter for pain, like Tylenol, Motrin, that kind of thing. And narcotics, which can be addictive, have to be written by a prescription by a doctor and kind of be able to make sure that they're taking care of you. All right, so moving on to the bottom of 123, tolerance. Tolerance. This is when the user's body becomes used to the effects of the drug, and so then larger and larger doses have to be given in order to get that same desired effect. And sometimes that's normal. So when you're younger, you may take just one Tylenol or one Motrin. My husband, he hardly ever has to take any kind of medication. So when he takes a ibuprofen, a Motrin, or whatever Tylenol, he only takes one, and that's what he needs in order to be able to um, get that same desired effect. But most of us would need two. And then some people who would have maybe frequent headaches or frequent back pain or whatever, they may even take more than that with the doctor's permission, because that's what it takes in order to get that same effect on your body. And that's called drug tolerance. Now, the problem is if you have a tolerance to an addictive drug, a narcotic of some sort, or sometimes even over-the-counter drugs, then people begin to take it going against what the doctor says, or they just take it a lot. And so that is then they become dependent or addicted to the drug. So dependence and addiction, those words kind of go hand in hand. On page 124, you'll see that. And basically, the user becomes unable to perform normal functions without thinking, without constantly wanting that drug, and they just can't function normally without it. So then, when they realize this, or maybe someone helps them realize this, they start to go off of that drug, and they have what they call dependent withdrawal symptoms, basically. And even people like me who drink a cup of coffee every day, I just have one cup of coffee every morning. Caffeine's considered um, like a drug, even though it's not, because it's not food or water. But because every day you need that, you want that to be able to kind of give you that morning kick, I guess is what you want to say. And if I go one day without having my cup of coffee, I know it. Sometimes I might get a little headache, or just feel kind of, groggy or whatever. And maybe some people it's Dr. Pepper, maybe some people it's, whatever, some sugar, it's basically the same idea, is that you will have some types of withdrawal symptoms. Now, people that have become drug addicts and they have severe addiction problems, um, with any, illegal drugs or even sometimes narcotics or over-the-counter drugs, those types of withdrawal symptoms are even greater, and people can have all kinds of issues and problems and almost feel like they're going crazy because they're going through those withdrawal symptoms. Babies who are born on drugs at times, the parent, the mother, would be on drugs, and the baby comes out that has drugs in their system. They'll actually wean that baby off of those drugs sometimes because they'll have to put just a little bit of those drugs in the baby's body each day, and then they'll lessen it so that the withdrawal symptoms aren't so horrid on that baby. And they basically have to get that baby off the drugs. And that's a terrible situation. All right, so let's talk about some illegal drugs, and or even partially illegal at this point. Marijuana. All right, marijuana is the most frequently used illegal drug, and of course, in a lot of states, it is actually legal now. It's legal for medicinal purposes in most areas. That means that they take it and they use it to help with pain or cancer. Patients will use this at times, and or they also have, in some states, recreational use, which means an occasional use or whatever. They would say that that is okay, and it just depends on the state that they're in there. So it's made from the leaves of or the blossoms of hemp, and you've probably heard of that before, or cannabis, and it's an extremely limited medical use, is what I said earlier, and it may be prescribed even to treat glaucoma, which is an eye disease as well. Um, Common slang names would be pot, grass, weed, smoking weeds, that kind of thing. And usually they'll roll it. They take the leaves of it, dry it out, and roll it up or whatever. So let's talk about the short-term effects of marijuana. Why is it not good to use? It has about 400 different chemicals in it, and when it's smoked, there's about 2,000 chemicals that come out of it that can maybe harmful to your body, of course, and they enter your body through the lungs. So it's fat soluble, which means it's dissolved in fat. Some things are water soluble, which means they'll be dissolved in water. But it can remain in your body, including your brain, for days after being used. And so the younger the person using marijuana, the greater the harm to the body, is what studies show. Um, it can also affect the way the nervous system works, helps you to not feel any concern for anything or that kind of stuff. And basically, some people would feel very like um, lightheaded or just like they don't have any care or concern. Some people actually has the opposite effect, and they feel panic and anxiety. They basically distort their senses, and they don't realize what's going on always. So sometimes marijuana can actually produce hallucinations. It means seeing, hearing, smelling things that aren't there. And remember, I told you in the last video about whenever I had to have that medication for my when I had surgery, and I kept thinking that I was seeing bugs or whatever. Even though I knew they weren't there, and that was a weird, bizarre feeling for sure. Because marijuana affects your nervous system so greatly, people with they really have a hard time keeping up with their schoolwork, doing their studies, remembering what they're supposed to do. It affects your short-term memory, and all of that kind of thing. And then long-term effects, they say that smoking marijuana has much greater effect than smoking cigarettes in the long run. There, it's inhaled more deeply and it's held for a longer period of time. A lot of habitual means they use it over and over and over again. Marijuana users would suffer from bronchitis a lot, sore throat, chest pain, that kind of thing. So obviously, just one of those things that we don't need to even start. All right, then you have another term here on the bottom of page 125. The term is inhalants, or sometimes people would say huffing. And that's just when something is sniffed or inhaled, snorted, they may even say. And this may cause hallucinations as well. And sometimes people will do common household products or something. Or back in the day, it was Smarties. Middle schoolers were smashing up Smarties and trying to snort them up their nose. Well, the problem is what is your nose and your passages are lined with mucous membrane and it will absorb into your bloodstream more quickly. But with that, with a Smartie or something like that, it doesn't actually cause your body to do weird things, even though, you get a little sugar, rush there or whatever. But it can damage all of your nasal passages up in here. And of course, we also want to avoid um, even just the idea or thoughts of doing something that would be wrong. And so avoiding all appearance of evil, that would be another reason why not to do such things like that. So stay away from that, pixie sticks, that kind of stuff. Just, yeah, don't do any of that. It can really damage all up in your sinus area there. And then you've got cocaine at the bottom of page 126. That's a stimulant. So let's talk about the difference between a stimulant and a depressant. It's exactly what it sounds like. Stimulants stimulate. They make things speed up. So your heart rate, your reactions, everything's a little nervous and you're jittery and you're, whatever. So that's what a stimulant would do. A depressant is going to slow things down, cause people to slow their words, slow your heart rate, and all of those types of things. Give you a feeling of just floatiness, kind of weird or whatever. I have to say, I've never experienced any of that. It's only what I've studied because I've never had any kind of drugs, illegal drugs of any sort. And so, or alcohol for that matter. And so, I can say, and I'm 42 years old, and I definitely have no desire for that. And I'm very thankful that the Lord has allowed me to be able to get to this point without any of those issues and problems, because there are a lot of deaths, a lot of families broken up because of alcohol, because of drug abuse, and that kind of thing. So, even though I just want to go by what the Bible says and try to do my best to not take these things into my body and not to damage in that way, and take care of my body the best that I possibly can in that realm. But it's really important also from a just a human standpoint that if you don't ever take one drink of alcohol, you'll never become an alcoholic. If you don't ever take one drink of alcohol, then you'll never kill someone on the roads drinking and driving. If you never do drugs, you'll never have an overdose. If you never do um, drugs, then you won't have an accident relating to that. So, in my mind, that's just kind of when in doubt, don't. It's just common sense. Um, all right, so some people sniff or snort cocaine, like we were talking about. It's a stimulant and it's going to increase blood pressure, make your heart rate go faster, and all of those types of things. The more concentrated it is, the higher, the more stimulating it would be in that realm there. And then repeatedly snorting and like that, I told you about that. It can damage permanently your mucous membrane and your sinuses and that kind of thing. Remember, it's all connected, all up in there. All right, and then the effects of cocaine usually wear off after 20 to 40 minutes, so people want more, and it's not cheap. And so people go and they will steal and do all kinds of things just to get a fix or to get whatever they need in there. And then you have a smoking form of cocaine, which is called crack and crack cocaine. It's easier to find for people. It's a little cheaper, but it creates almost instant highs, is what they call it. Stimulant would make it high. there. And then basically the same effects there of cocaine would be crack. And then also something that the book doesn't really talk about, but it's something that like sometimes the drug makers or the sellers or whatever you want to call them, those people will lace a drug with something that is even worse than what cocaine or crack or something like that can be. So um, obviously, those are people that cannot be trusted. So so basically, we'll talk a little bit more about that. But the reason why we're learning about those things is so that you realize why it's such a big deal to not ever even start taking drugs, not to ever even start drinking, not to start these things or make up your mind now because, people, especially in their teenage years, oftentimes are introduced to that and they think, oh, it's fine. I just want to try it and see what it feels like, or whatever. And then they become addicted to it and can't get away from it, and it ruins lives. And so it's important to realize now what the ramifications are of it and to help you to determine in your heart and your mind now to just say no. All right, so that is through 127, and I will see you tomorrow.